So Susan, please tell us about the Wales Cancer Patient Experience Survey. What's it all about?
The Cancer Patient Experience Survey is a chance for people who have been affected by cancer and treated for cancer in Wales to have their voice heard about their experiences of care and treatment in Welsh hospitals.
And how has Macmillan been involved in this survey?
Macmillan has commissioned the survey in partnership with Welsh Government because we think that hearing from patients about their experiences, what's good in care and what's not so good, is really important. Then we know what we can do to help support better care for others going forward.
How many people responded to the survey and what would we like to say to them?
I'd love to say a huge thank you to everyone who took the time to complete the survey and have given us the rich information that we can now use to help support better care for other cancer patients in Wales. Over 11,000 people were invited to complete the survey and over 6,700 responses were received, which is an amazingly high return rate.
Tell us.
The survey told us that over 93% of people treated for cancer in Wales were positive about the care that they had. However, below that, there are a number of areas that it clearly did identify needed improvement as well. So, whilst on one hand there's much to celebrate, there are also areas that we need to improve for other cancer patients for the future.
What are the areas that need improvement in Macmillan's view?
One of the areas that came out very clearly was that having a clinical nurse specialist supporting you and coordinating your care and treatment is really important. On 73 of the 74 questions, those people who had a clinical nurse specialist reported a much better experience than those who didn't. For example, 55% of people with a clinical nurse specialist were signposted on to other help that they may need, and such as support from other organisations, charities, support groups, whereas this figure dropped considerably to 29% for those people who did not have a clinical nurse specialist. We also know that one of the areas for Macmillan is about making sure people have a chance to discuss their care needs with their key worker or clinical nurse specialist. And again, disappointingly, only 18% of people were offered, after this discussion, a written care plan. This really needs to change.
Why is having something like a written care plan so important for people with cancer?
It's important that people have a discussion with their clinical nurse specialist or key worker about their wider care needs, because cancer can be a very devastating illness. It may mean that you need to stop work. It may mean that your finances dry up almost overnight for some people, and it does mean that you may need a lot more practical support and emotional support as well. So it is clearly important to have the right treatment, but people need to have that holistic care wrapped around them as well. And that conversation about their care needs is really important. And to follow that up with a care plan that is written, that someone can take away, can share with their family, can share with their GP, can share with other clinicians if they so choose, helps them to be more in control of the cancer and know what they can do and who can help them as well.
In terms then of the results, how will Macmillan use the results to improve care?
The results are available to everybody. They are published. They are on the website of Welsh Government, so patients can look at them, their family can look at them, the public can look at them, as well as all the clinicians and professionals caring for people in Wales. We want to make sure that that information is used to drive improvement in services and to achieve the promises that are set out in the Cancer Delivery Plan, that everybody has access to a clinical nurse specialist and a key worker, that everyone has access to a discussion about their care needs, that they have the opportunity of having a written care plan. And we know again how important finances are, that for people who need to be signposted to welfare benefits and financial support and advice, that this is done in a timely way for everybody.
Okay. So Susan, what did the survey tell us about information for people with cancer?
Well, we know that having the right information is so important to be able to manage your broader care needs as well as your treatment, and to be able to make the right decisions about what treatment is the most appropriate for you and for your family. We know that having a clinical nurse specialist meant that people were given more information. 85% of people received written information about the side effects of their cancer and the treatment if they had a clinical nurse specialist, whilst this dropped significantly if you did not have access to that person. We also know that only 48% of people received information about financial support. Again, this is far too low, and more people wanted to have that information when they needed it in a timely way before financial problems escalate. So we know that there are a number of areas where information about care, support, finances, and also about the treatment is not as high as it needs to be.